What's up, you guys? My name is Miguel, fellow Xray Tech here, giving your daily dose of radiation. In today's video, we are explaining some of the issues you face or challenges you face when you exposing bigger patients that maybe push the limit of your table, of the Xray table, or of your Xray portable board. So to give you context, I'm a night shift Xray Tech. I've been doing it for about 4 years, and I would say that both the image quality and both your fear of them breaking your equipment and also scatter radiation are some of the three biggest concerns. Maybe fourth is how to get the patient onto the table or getting the board underneath them. Those are a few things that four things you could say that are the main concern. Some doctors will order X-rays, and depending on if, like, there's a difference between being big. It all kind of depends on how the adipose tissue is distributed, right? If the patient is very wide, like the fat spreads and it's like not super thick, but it's just they're wide, you could probably get some decent images. But it's when the patients are more like I guess like Santa Claus, like where it's like thicker, like they're not that big, but it's just super, like their belly or their chest, like stuff gets like super like wide, like thick. That's when the issues come, because the X-ray machine can only get so much, and Lord forgive, they have equipment in there that causes the images to be less good. That all comes into play. Like, there's been so many times where I've had to shoot a KUB on a patient that will push the brim of my equipment, and I'll shoot it, and you gotta shoot that hot with a grid, long beep portable, and the amount of radiation that you're pumping into this poor patient, and just to get the image, and you're like, can't see none. There's been so many times their doctors will order an L spine, and we're like, ma'am, the patients, literally, there's been times, and it's more the lady ones, that their bottom is so big that like there's a gap between the board and the patient, like they're standing, or like there's too much, and you take the X-ray and you're like, I can't see nothing. Majority of the time, if you go to CAT scan and maybe you have the same level of patient, you could probably get a little bit of better image in CAT scan, because they use higher level of radiation. The problem is, at a certain level, they can't fit through the little gantry hole, and they can't push them to get the CAT scan done. So sometimes they'll think, oh, maybe an X-ray will do. Sometimes we'll explain to doctors, they'll be like, hey, patient is big, you're not going to be able to see anything, but I'll do it anyways. Sometimes they're like, okay, well, we'll try something else. Other times they'll commit to it and want you to do it anyway, and then you shoot it, and then you see it, and like you'll send it, and you're like, see what I mean? Like we just pump this patient up with ungodly amount of radiation for nothing. Right? So some of those are like the ethical things that we deal with here. And since we live in America, we shoot a lot of big people. Now, obviously, if you're doing like a hand, maybe a chest, maybe a foot on someone, it didn't even matter if they're 500, 600 pounds, you could probably still do it, because there's not that much pressure on the table, that much like on your little board, like you'll be fine. But once you start placing the board, maybe for a T-spine, maybe for L-spine, maybe for hip or femur, and they have all their weight on it, that's when you can come into the issues of they're going to break your equipment, and you're going to get in trouble, because we know the limits, and we know when we should stop. Our majority of our equipment costs a lot of money, so you have to be careful. So yeah, it's been your boy Miguel. See you on the next one.